Hello, hello to all the cancer caregivers out there. This is Dr. Janine Grace with the Cancer Detox, where we are all about supporting cancer patients as they go through their own diagnosis, as well as giving cancer caregivers some much needed information they need to know in order to help their loved ones and friends. So, COVID and cancer. Clearly, the two don't mix. It's not uncommon for cancer patients to have to deal with some infections similar to COVID as they go through various chemotherapies, as they go through various immunosuppressive treatments. However, with COVID-19, and the recent pandemic that has plagued the world for 2020, what exactly do cancer patients need to support themselves during this time? And this is what we want to talk about today. So, how do you manage cancer care during the COVID-19 pandemic? And I think this is something that cancer caregivers definitely need to take heed and work with their family members and friends, because the National Comprehensive Cancer Network is discussing resources for the cancer care community. And you being a cancer caregiver, you are part of that cancer care community. Even though you're not a healthcare practitioner, you are providing help and guidance for your family and friends going through a cancer diagnosis. So, this is a recent report that came out of the Seattle Cancer Care Alliance, and they are a member institution of the National Comprehensive Cancer Network, otherwise known as NCCN. And they are providing some really great proactive ways that everybody in the healthcare community should be thinking about, but I thought this could be very applicable to cancer caregivers. So that's why I'm presenting it today. Now, one of the co-authors of the study, Dr. Robert Carlson, MD, who is the CEO of the NCCN, stated, people with cancer appear to be at increased risk of COVID-19, and their outcomes are worse than individuals without cancer. The NCCN member institutions are rapidly gaining experience in preventing and managing COVID-19. Therefore, they're sharing their experience in an organized and managed way to other hospitals and institutions within this network. And so you can find this on the NCCN website, the COVID-19 resources, and I think you definitely need to go there and check it out. But we're going to highlight a few things here in this particular video. The number one thing you should walk away with is you need to be proactive in helping to squash the potential spread of COVID-19 to your families and friends who are going through a cancer diagnosis. So there are a few things I want to highlight here that I think are very important, and things that you need to talk to your friends and family about who are dealing with cancer and who are possibly going to have to go to the hospital in the coming months and possibly maybe even in the next year. So one thing to consider is definitely look at rescheduling well visits as well as elective surgeries. And if you do already have your care established, you don't need a second opinion, you may want to defer getting a second opinion. Now, at the Cancer Detox, we're all about getting second opinions. We're all about making sure that we get the appropriate information to cancer patients. But during COVID-19, you may want to hold off on second opinion consultations. And if you must get a second opinion, make sure you do the research, cancer caregivers, to help the patients fine-tune which offices your family and friends are going to attend. So rescheduling those wellness visits and elective surgeries for right now might be the more prudent approach as we're going through summer 2020, as we're seeing the COVID-19 spread and increase in other areas of the country besides the coast. So it's coming into the Midwest, it's coming into the Southeast. So you definitely want to take heed about that. The other thing you want to consider is truly reinforcing a very strict stay at home when ill policy. Now, clearly, cancer patients are going to have various types of illnesses that are not going to be similar to the ones you would see with COVID-19. They may be feeling fatigued. They may be feeling nauseous or having other issues, tingling in their limbs. Everything is a sign. And so any type of illness or anything that's going to make them feel not their optimal self means that they really need to stay at home because they could be more susceptible to COVID-19 during this time. You also want to prioritize the use of soap and water over hand gel. I can't stress this enough. Water mobilizes bacteria and viruses. What do I mean by that? It gets rid of them. It moves them away from you. Water does that. Hand gel relies on alcohol in order to inactivate or kill the bacteria and virus. Water mobilizes them. So soap and water is the best approach. As well, if you are going to doctor's visits with your family or loved one, family and friends during COVID-19, please ensure that the number of team members who are in the patient's room is limited. And there may be some hospitals that are not following this practice, but this is an important practice for you to follow. So please, 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 allow and have that strict rule of very few team members who are in the patient's room. You also want to adopt a no visitor policy at the house where your family or friends are living who are dealing with cancer. Of course, if your family or friend is going through an end of life situation, then you want to ensure that appropriate visitors are allowed. But that kind of leads into the next and final point about this whole thing is that you want to have those upfront, proactive, palliative, and end of life scenarios hashed out should something happen to your family or friend. So thanks for tuning in. This is the Cancer Detox, where we're all about supporting cancer patients as they go through a cancer diagnosis. You can get in touch with us at thecancerdetox.com, email us at hello@thecancerdetox.com, or call and text at 678-310-8101. This is Dr. Deneen Grace with the Cancer Detox. Hope you enjoyed this particular webinar, and we'll talk to you soon.